Welcome to the Registry Insider. I'm Bill Seifarth, CEO and Executive Director of the National Registry of EMTs. And today we're going to have a tad bit of a history lesson, if you will, in EMS. Joining me is Donnie Woodyard. He's the Executive Director for the EMS Compact. And I have to say, you're pretty passionate about the history of EMS.
Oh, absolutely, Bill. You know, I got a passion for it actually a number of years ago, just doing some basic research, trying to understand really our origins. Yeah. And I started pulling on a string and then kept pulling. And then all of a sudden, this whole world opened up about really how our modern EMS system came about.
So let's go down a little bit of walk of history lane here. And obviously, 1966, momentous. A lot happened in EMS prior to then, but 1966 was an important year. What was that?
Yeah, well, I mean, you know, we really had the accidental death and disability and the white paper that was produced out. And that really did a number of things. It brought to light the fact that the interstate system in the U.S. was expanding. People were traveling. People were going high speed. And we had this new thing of car crashes, and the fatality rate and the death rate of these car crashes was just really getting out of control.
Higher than the Vietnam War.
Absolutely. In fact, that was one of the very powerful statements that a soldier in Vietnam at the time had a better chance of receiving care than someone on the American highway. And that was a resonating statement that really called for a coordinated approach to solve this epidemic of death and disability on our nation's highways.
Which actually leads to another fun fact, but that's how the Office of EMS ended up at the National Highway Traffic Safety Administration, was because of the highway deaths that were happening so frequently.
Yeah, absolutely. And, you know, a unique piece of that history. So there's a semi-lost character in history, and Roddy Brands. Mm-hmm. And so he was actually the president of the Ambulance Association of America and lived in Charlotte, North Carolina. Now, he became the first chair of the National Registry of EMTs, which was called the Registry of EMT Ambulances at the time. But he also testified before Congress on the need for a coordinating office. And through part of his testimony, actually, the NHTSA Office of EMS was created.
Yeah. And fast forward to 1969. And the Johnson administration said there was a need for some standardization and uniformity and some national testing, right?
Absolutely. So, wow, what an amazing time. If I could go back and live through that time, Bill, it'd just be fascinating. So you had the American Medical Association, mm-hmm. and the American Medical Association had joined arms with the American College of Surgeons, mm-hmm. and they recognized this issue. They joined arms with the National Institutes of Health, mm-hmm. and President Johnson actually created this commission to look at solving this national issue. And in early 1969, there was this fascinating conference called the Arley House Conference, mm-hmm. that happened in Warrenton, Virginia. And you had all these incredible leaders that came together. You had
luminaries.
Yeah. You had Dr. Seifarth. You had Dr. Farrington. You had Dr. Rockwood from San Antonio. You had Dr. Eugene Nagel. You had Rocco Mirando that mm-hmm. was there. You had Roddy Brands that was there. You had all these people that came together. And they really collaborated on unifying their vision and saying, how can we solve this issue? And to your question, one of the issues to solve is individual towns and communities and doctors had started training programs across the nation to better train the ambulance drivers who were driving the hearses and some of the ambulances. Mm-hmm. And there was a need for a national standard. So actually, Dr. Peter Seifarth, who is founder of CPR and critical care medicine,
as well as Freedom House.
And Freedom House Ambulance, wrote a white paper that said there's a need for a national unified certification. And then just a few months later, the organization was brought together to solve this, and the national certification body was defined as the Registry of EMTs. And then in 1970, they had their first meeting
on June 4th.
And as you know, soon after that, actually changed their name to the National Registry of EMTs. But it really came out of this need for a national standard, the need to unify, and the need for public protection to make sure that when you identify as an EMT or a paramedic, at the time it was EMT. As we know, paramedics came a few years later.
Yeah.
But when you identify as an EMT, that was a protected term. And our luminary founders knew the importance of protecting that literally from day one.
Mm-hmm. And that's continued. From the National Registry perspective, June 4th, 1970, as timing of this shooting, it's 2024. So we have 54 years that we've been doing the same thing as an organization. So the EMS profession has evolved quite a bit. And through the 70s, we got the accreditation became through the JRC. Mm-hmm. We had paramedic curriculum that was founded. Nancy Caroline was very famous in terms of writing the Orange Book.
Yes.
And the Freedom House was founded. There was a lot of EMS was in its infancy on different areas of the country, on West and East Coast across the country. So a lot of exciting firsts happened in the 70s.
Oh, it's really amazing when you look at that period. So, when we look at those luminaries, a few things that really come together. One is these were people who lived all across the country. Mm-hmm. Many of them were physicians, and they didn't have access to email or Zoom meetings. They didn't have access to the internet, but yet they prioritized collaboration. They prioritized working together. They prioritized actually not only just having a vision, but executing on that vision. Mm-hmm. And then really unifying around that and leaning forward. So, in addition to what you said, some of the other first, it was Dr. Farrington. So Dr. Farrington was the first physician chair of the National Registry. Right. And in the
his gavel's in my office.
Oh, amazing. In the 1950s, he actually created the outline of what is arguably the first EMT training. Mm-hmm. And then he partnered up with the American College of Orthopedic Surgeons and Dr. Charles Rockwood from San Antonio. Mm-hmm. And then they produced the Orange Book. But Dr. Rockwood also did something else amazing in 1975. And that is he wrote an official paper from the National Registry Board to the AMA at the time, requesting this new profession of paramedicine to actually be recognized, in his words, as a bona fide professional allied health profession. Mm-hmm. And that letter really set the foundation for our modern practice. And it's really fascinating to look back and understand that our profession was literally founded from some of the most amazing medical minds that existed in America at the time.
So one other momentous thing or element related to the early years of EMS is the Star of Life. Has an interesting history, and I will say the story is often mistold. Share with us a little bit about the real story of the Star of Life.
Yeah, here's the real story. In fact, I look behind us here at the National Registry logo with the Star of Life prominent.
Yeah,
and that's actually very important because in the early 1960s, around 1962, 1963, this is before there was this movement for EMS to really happen. The American Medical Association created the Universal Medical Identification Symbol. Mm-hmm. And it was the Star of Life, not yet called that, but it had a hexagon around it. And they produced this symbol kind of as a medical alert symbol. So they were encouraging anyone with diabetes or epilepsy or other serious medical conditions to actually carry a card with the symbol on it. In 1964, it was adopted by the World Health Assembly as the global symbol for emergency identification. So in just a couple years after that, the AMA actually was building momentum, and this symbol was being associated with emergencies. And they wrote to the DOT and said, hey, let's start using this symbol to designate hospitals that had an emergency room that was staffed. Again, a relatively novel concept in the 60s. Mm-hmm. going back to our last discussion, when the Presidential Council was formed to actually look at national certification, AMA was the primary driver there. And they formed this new organization, the Registry of EMTs. And this new organization needed a symbol. So the AMA said, this symbol is already getting some recognition in emergency. Let's gift this symbol officially from the AMA to the Registry of EMTs, and it will be exclusively for these new EMS personnel that meet the national standard. And just a couple years later, the registry actually filed for a trademark and was awarded the first trademark with the Star of Life that incorporated that into the symbol that we know today. Now that's some of the unknown parts of history, but then it gets a little fuzzy for some people after that. So at the same time, ambulances were kind of popping up all across the nation. And we had a lot of soldiers and military members that were coming back and serving in their local communities. Well, of course, in international war, the Red Cross is a very well-known symbol. So we had Red Crosses showing up on ambulances here. And then we had the Omaha Orange Cross, which was simply a Red Cross that we had painted orange. And that was also showing up. Well, it turns out those two things were a violation of both a congressional mandate and the Geneva Convention. And so the Department of Transportation came under incredible pressure of saying, you can no longer use a Red Cross or an Orange Cross on ambulances. You need a new symbol. Well, DOT and NHTSA was very much part of the National Registry. And so the National Registry, Dr. Ferriton, actually said, you know what, why don't we take this symbol and make it the national symbol for the profession? And that's how the symbol got gifted first from the AMA to the Registry of EMTs and the National Registry. And then the National Registry, Dr. Ferriton actually wrote a letter and gifted it to NHTSA. And then NHTSA added the 6 designations around it, defining EMS. And in 1977, NHTSA was granted a federal trademark for just the Star of Life.
So it's a fascinating history, much of which is not known, and some of which is controversial, and people would disagree on it. But I appreciate you walking us down history lane on that. So the 1960s and 70s, the founding years of EMS were fascinating. And obviously, as a history buff, you're passionate about that. Yeah. Where can people go to find out more about EMS history, to read more
absolutely.
Beyond the 60s and 70s, but to present?
Yeah. So I have a website, and it's the EMS-history.com. And that website has many of these original documents, the government documents that are there, the congressional testimonies, and there's so much fascinating information there. And you can download all that for free. So that'd be one good site to go.
So what is that again? EMS-history.com?
EMS-history.com.
Excellent.
And then there's a couple other good resources. I would encourage people to consider things like the National EMS Museum and
our website, NREMT.org. You can look at history, and has
a tremendous amount of history on there. And a very important part of our nation's story is actually guided through the National Registry.
You also are the author of a book, EMS in the United States, Fragmented Past, Future of Opportunity, which is primarily a great desk reference for state EMS officials, which you publish work on, and they get a copy of this book. It is a great book. I was fortunate enough to read it early on for you, and phenomenal resource. Where can they get it?
Yeah, actually that same website, EMS-history.com. You can go there. It's also available on Barnes & Noble and Amazon.
Awesome.
And it's available on both of those sites. And, you know, the passion for that book, Bill, really was to outline not only the history of EMS, but, you know, today, EMS, we're faced with a lot of challenges.
Yes, we are.
And as we navigate these challenges, it's important to really develop an understanding of all the years that went into how we got here. Mm-hmm. And by really building that foundation, we're better equipped to navigate for the future. And it's also a resource book. I mean, there's a lot of acronyms in EMS. There's a lot of parts of the system. and even the part that you really helped out with on the National Registry and national certification and understanding how that works.
Good. Well, thank you for taking time to talk a little bit, especially the first founding few years of EMS and walking down history lane. Fascinating content and amazing conversation. So thank you very much.
Thank you, Bill. It's a joy to be here.
Awesome. Thank you very much for joining us. And as always, stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications about upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.